water and sanitation. We've been trying to find a lasting solution to it in Ghana. Across the world, Ghana is ranked, way up there. The negativity is high. How do we turn our story around? I've been joined this morning by Madame Loretta Roberts. She's the WASH specialist from UNICEF. Also, Alberto Walti is a country director of Global Communications. Ladies and gentlemen, welcome. Thank you very much.
Thank you.
What would be the global outlook, first of all, on sanitation, open defecation, and all the issues that we want to talk about? I'll start with you, Oscar. What will be the global outlook, first of all? Let's try and put it in perspective.
Okay, thank you. Well, the world, as unified, has decided to eradicate open defecation worldwide.
Right.
We are going to what we call the Sustainable Development Goals,
Right.
number 6, to eradicate open defecation.
Right.
And Ghana is on track of doing that
Okay.
by 2030. So the government, along with implementing partners and donors, are trying to put measures in place to attain that goal, which is a huge and ambitious goal, but is doable.
I see. Loretta, the last time I checked, Ghana was second in Africa. We're spending billions of cedis, to try and stop this. Has the story changed?
Well, Ghana's story has not really changed that much. The good thing is that there are communities
Okay.
that have completely eliminated open defecation.
Okay.
But then the coverage is still quite low. I mean, it may interest you to know that out of 26 countries worldwide that have been identified by UNICEF as carrying the highest burden of OD, Ghana is one of them. But we have made some progress in the sense that at least now we know there are solutions out there.
Okay.
So the situation is not as depressing as it used to be. But then we need to scale up our interventions for us to make the required progress towards the sustainable development goals that Mr. Alberto spoke about.
2030, are we within the timeline? Are we able to achieve an eradication of open defecation in Ghana by 2030?
I think it is possible if we have both the political will, which should translate then into financial provision for services. It is possible.
Alberto, what are the challenges that you have encountered in trying to achieve this goal of 2030? Tell me about it.
The main challenge is the behavior.
Okay.
We often we want the government to solve every problem for us, but we have to apply what President Kennedy said before. It's not what the country can do for you, it's what can you do for your country.
Right.
So the change has to start from ourselves, our behavior. We are the ones doing open defecation. It's not the government.
Right.
So unless we change our behavior, we cannot expect the change overnight.
Right.
So it's the same with sanitation. When we said, oh, pollution is a problem, plastic is killing us. No, plastic is not killing us. We are the ones buying the plastic and throwing the plastic. So this is the fundamental issue with open defecation.
Right.
Unless people, every individual, change their perception about open defecation, we cannot change anything. So that's the starting point, and then everything will roll out automatically.
Loretta, we have then decided that, okay, let's set up a Ministry of Sanitation and Water Resources to look at it, have a framework, plenty English, and all of that. In terms of construction and usage of latrines that people can access to prevent them from openly defecating, what levels are we now? Are we doing better? Are we not?
Okay, so I think the establishment of the ministry is actually a step in the right direction.
Right.
As you rightly know, once you have focus on a subject, it makes it much easier then to make progress.
Okay.
In terms of our statistics, according to the last JMP, we still just have about 19% of the population still practicing open defecation.
Right.
And then there's another 57% who are still using facilities that you cannot tag has improved, because some of them are shared. So it is, we haven't made that much progress in terms of the statistics. But as I said, there are interventions on the ground. We currently have over 2,000 open defecation free communities in Ghana. These are communities that have completely eradicated open defecation. And on the program that UNICEF implements with government, we already have over 68,000 toilets that have been built by the households themselves. And this is where the behavior change bit comes in, because once people get convinced that they need to stop open defecation, they will be able to put up the toilets.
Alberto, let's talk about subsidies and what your experiences have been in terms of providing subsidies to fix these latrines so people can use it in their houses. What would you say?
Well, the CLTS, the Community-Led Total Sanitation, talks about non-subsidy. But we cannot, when we talk about low-income people, we cannot pretend that they will fully pay everything. So there is a component, there must be a component of subsidy somehow. For example, if you build your house in New York, in a big city, you build your house and you connect the water and you connect to the sewage system. But you're not expected to pay for the sewage system. So that has been subsidized by somebody. And you're wealthy because you are in a large and big city. So how can we expect that a low-income person in Ghana will be able to afford the whole system? So this is what I'm saying. It's very important that the person gets some support, either from a reduced price from a producer, or a component of subsidy coming from the government, which it's starting to roll out. The government has put some measures in place along with some implementing partners.
Toilets at half price, I've heard that.
Half price. But that is the kind of support we need. But also, it's not just about the subsidy, it's about of the cost of the solution. If I tell you I'm going to subsidize 50% of $2,000, $1,000 is still very expensive. It's not affordable. So the subsidy has to go along with a solution that is affordable for the people.
Interesting. Loretta, then it brings me to the question. There's a subsidy, yet a lot more people are not getting it because of what Alberto talks about. It's expensive. Is it perhaps because we have lost sight of the fact that the attendant effect of open defecation, what it could do to us, harm us in the near future? Are we not aware of these?
I do think that the effects are quite obvious. I mean, anytime a child gets diarrhea, you can be sure that most likely that child has ingested fecal matter. And it is well known that this is the second killer of children in Ghana, next to malaria. What I think is that because the challenge for Ghana is so huge, and I earlier on told you, a fifth of Ghanaians are practicing open defecation. If you were really to look at the amount involved to support these people, you're looking at something between $100 million to $500 million, because then just in that bracket they need 1 million toilets. Looking at our economy, I do not know if the government will be able to provide all these funds, and that is where the issue of targeted subsidies comes in, so that those who can afford would then be able to put up the facilities themselves based on programming for behavior change and then law enforcement. Then there may also be another group who may be able to afford in the long run but may not have the money up front. For them, you may need to come up with a loan facility. And maybe you may have heard just a few weeks ago, we launched the Basic Sanitation Fund. Yes, so this provides those people with an opportunity to borrow and then pay later. And then still acquire sanitation facilities. And then there is that last bracket, the poorest of the poor, who may never be able to afford it themselves. They then need to be targeted properly in a way that will ensure that the others who can afford are not demotivated,
Right.
or do not just sit back to say we are waiting for our turn, because then our coverage will never go up the way it
I
should.
bet you the poor, the vulnerable are usually in this particular bracket. How do we ensure that we are sustaining this through research, education, law enforcement, like she's talked about, and funding, most importantly? What's your plan?
Well, there are some solutions out there. Identifying the poorest of the poor. We, in every community in Ghana, when you visit the community, people will know who are the vulnerable. Women with multiple children, or handicapped people, or elder people who have no support. So those people are the lowest bracket, as Loretta was identifying, that they need the support. And the community is ready to help and support those people. Now, we have to make the funds available to get to the lowest bracket and support them with a sustainable latrine. Another thing that I want to emphasize is...
The funds from where, by the way?
Well, the funds, they're international donors. As I always said, funds is not a problem. Money is not an issue. It's how that money is being spent. That is the main issue. And the allocation of those funds can go, if they are utilized properly and wisely, those funds can go where they need to go and to the bottom of the bracket.
So the donor funds come in, but what contribution do you press on government to say have their own, support, that they say you're bringing 70%, they need to contribute 30%?
Yes.
And not to say that you are doing 100% for government. Do you drum this home to say the Minister for Sanitation and Water Resources?
Yes, definitely. There have been some experiences, there's some evidence that it's working. So, and it's not that the people don't want to build their latrines, or they don't want to use a latrine. It's that they don't have the means to build a latrine. And if you go to villages and you ask a person to build their own latrine with their local materials, there's just so much that they can do. And there's just so much that latrine will last. And after 3 months, 4 months, that latrine is going to collapse. And the person cannot continue to build and rebuild their latrine. So you have to give them the means to build a latrine that will last longer.
Most grateful. Thank you very much. Madam Loretta, take closing thoughts from you, 30 seconds.
Yes, just to say, I think we really want to study the issue of how to target properly.
There's the Asian example where we've seen what they've been able to do, targeting the poor and the vulnerable. Can we copy from that?
Yes, I think so, but it must be done with care, because one of the things that I think makes it quite interesting is that their subsidy system has not affected those who can afford. So in actual fact, those who can afford have built the toilets, and the subsidies have gone to the poorest. And this is what we need to learn.
Most grateful. Thank you very much, Madam Loretta Roberts. She's the WASH specialist from UNICEF. Also, Alberto Wade is the country director of global communications, and they've been my guest talking about open defecation, sanitation, how to improve our lot.